is Mandy, and I am a labor and delivery nurse. Today, I am going to talk about a subject near and dear to those in my profession. I am going to explain why labor should occur naturally unless medically necessary. We all know that no one likes to be rushed, especially babies. Everyone wants to deliver a healthy baby. But what some may not know is that babies need at least 40 full weeks to develop and grow. A baby's brain at 35 weeks is only 2/3 the size it will be at 40 weeks. Although 37 weeks is considered term, some 37-week babies still have problems. These problems may include, but are not limited to, jaundice, trouble eating, low blood sugar, developmental delays, infection, and sepsis, and also difficulty eating and breathing. 2 or 3 weeks may not seem like a big deal, but to an infant it is. Babies born just 2 or 3 weeks early can have twice the number of complications with breathing as full-term babies, and may cause them to need to stay in the neonatal intensive care unit. Babies in the intensive care unit endure more pokes and prods and breastfeed less effectively than full-term babies do. Preterm babies may also have feeding tubes because they are too immature to suck on a bottle or breastfeed. Some early babies also require oxygen and IV therapy. Some of these complications are invasive and may be avoided by allowing your body to go into labor on its own and not signing up for an elective induction. Imagine having to go home without your baby. He or she had to stay longer in the NICU as a result of being induced for no good reason. You would be devastated and wish that you would have chosen to wait for your natural labor to occur. I know from experience that being pregnant isn't always fun. Whether it's due to nausea, vomiting, frequent urination, cramping, back pain, swelling, or just the general discomfort of pregnancy. Pregnancy definitely has its challenges. While delivering early may seem tempting, especially during the last few weeks, I urge you to delight in those kicks and flips and marvel at the life growing inside of you. Many people say that being induced is more convenient. However, the only person that may benefit from induction is a physician. Many private physicians choose to do induction so they don't have to come in the middle of the night or interrupt their golf games. Nothing is convenient about having a longer labor. Depending on the circumstances, inductions can take 24 to 36 hours. This means you're stuck in bed, not allowed to eat or drink anything, or get up and use the restroom most of the time. Inductions may also include invasive procedures, such as Foley bulbs. So a Foley bulb is when you're not dilated and the doctor wants to make your cervix open up and dilate. So they take this large catheter, they will insert it into your cervix, then the nurse comes and blows it up with 60 milliliters of normal saline, and it now is inside of your cervix and looks like this. The nurse pulls on it every 30 minutes and takes it to your leg until it comes out, and then you'll be dilated. It's very painful. Inductions may also put you and your baby at a risk of infection due to multiple vaginal exams and prolonged rupture of membranes. Because your body isn't ready, an unnecessary induction may put you at a greater risk for needing a C-section. Babies also don't tolerate labor as easily if it occurs by induction because there's more invasive procedures performed to them. A C-section is a major surgery, and it has many risks like bleeding, infection, injury to your bowel or bladder, injury to your baby, and in some cases, even death. Ending up with a C-section can also leave you unsatisfied. Only one person can accompany you to the OR for a C-section, and you may not have the family support you desire at your delivery. Recovery from a vaginal delivery is also much faster and less painful. You wouldn't take a cake out of the oven too early, so why would you take a baby out too early? There are certain medical reasons that patients may need to deliver early. I am not judging these patients, and I agree that in these situations, benefits of delivery may outweigh the risk of comorbidities. However, inducing labor just for convenience is not the best way to go. Your baby will let you know when he or she is ready to come. I urge you to be a patient advocate and encourage your patients, your families, and your friends to steer clear of inductions if at all possible. For a more detailed discussion on the topic, you can visit 40 Reasons to Go the Full 40 at www.gothefull40.com. Does anyone have any questions? Well, thank you for your time, and if you guys have any questions, just go to the website and hopefully that'll help you. Have a good night.